Hi, Michelle.
Hi, Michelle.
Hi, Dara. Hi, Dr. Chapman. How are you guys doing today?
Good.
Hi,
How are you?
Very well, thank you.
Good.
Great.
Now, Dara, where are you from and where do you live now?
I'm from California. I live in Boston, Massachusetts now. Actually,
what about
it's
you,
like
Dr. Chapman?
Dover, Massachusetts.
I'm in Hanover, New Hampshire at Dartmouth Hitchcock Medical Center.
Now, Dara, what have you been up to the last few years?
Well, I have an 11-year-old, so that pretty much takes a lot of time out of my day to deal with her. I shouldn't say deal, but take care of her and stuff. And a couple stepkids. And I don't know, just doing my usual stuff, hoping to start up a supplement line and doing this wonderful Show More You campaign.
Great. Well, I look forward to asking more about that in a moment. Do you still swim?
I do swim a little bit, maybe once or twice a week, strictly for exercise. I tell the coach, do not get your stopwatch out because I'm doing nothing fast. But I love now doing boxing. It's a wonderful form of exercise, and also bar method are probably my two favorite things to do right now.
Now, do you think that you impacted the global mindset concerning age and athleticism?
Well, that's a nice thing to say. I'm not sure if I have. I know that there are people who have come up to me, athletes, and basically have said that that I've inspired them, or they've asked me for some help. Just recently, an NHL player asked for some of my insight because he's retiring, but he wants to maybe try for the Olympic team. So it's a very rewarding feeling knowing that there are athletes out there who are staying in their sports longer.
Now, are you following any amateur swimmers before they make it to the Olympics?
I do some, but I find my life so busy. I mean, I'm always going to be obviously attached to swimming. It's pretty much been my life, but I'm not quite as involved in following it all, but I still get the USA Swimming updates.
Now, doctor, can you please tell me a little bit about yourself?
Sure. I'm a dermatologist. I originally grew up in Louisiana. I've been in New Hampshire for the past 21 years. I have two kids, 21 and 18, and I pretty much work. Dermatology consumes me. I run the department at Dartmouth, and this is a great break from my reality, so I'm happy to be here.
Now, what is psoriasis?
Psoriasis is a skin condition. It is very common. 7 to 8 million people in the United States have psoriasis. It's an inflammation of the skin which leads to large patches and plaques that are very scaly, itchy. Sometimes they bleed. It's not an infection. It's not contagious. There's a lot of myths around that. About 30% of patients with psoriasis also develop psoriatic arthritis, which is a type of arthritis, a joint inflammation that leads to hot, swollen, painful joints as well.
Now, what are some myths that must be dispelled about psoriasis?
I think if you ask most patients, including Dara, people out there that don't really know a lot about medicine, they think that a lot of skin diseases are contagious, or that their children might get them, or somehow they need to avoid those people with the skin diseases. Psoriasis is one of those. It's very difficult to hide in some people. It prevents them from wearing shorts and short sleeves. So I think the idea of people not really knowing what it is and that it might be contagious or cancer and the patient somehow sick or has a disease, we say condition rather than a disease, is really the first place people need to start with understanding what psoriasis is.
Now, what are the treatment options?
So that's a little bit of a complicated question in that there are a lot of treatment options, and if you went back 20 years ago, we didn't do so well. We had topical steroids. We would actually admit the worst severe patients to the hospital to treat their psoriasis. A lot of people don't know that. We only had tar therapy, sometimes light therapy, which could also lead to skin cancer down the road. So those were therapies we used, but they weren't very good. They weren't very safe. These days we have great therapies. There's injectable therapies, and there are oral medications now too. We can continue to get better and better. One of those medications is Otezla. The generic name is Apremilast, and it's an oral medication, really easy to take, great side effect profile, and no laboratory monitoring.
Now, who is most likely to be affected by psoriasis?
Well, in general, you don't really know who's going to get psoriasis, but you have a clue if you look at one's genetics or one's family history. A lot of times patients with psoriasis will have family members, mother or father, maybe a sibling that has psoriasis, but you really don't know who's going to develop it. And sometimes the parents have psoriasis and the children don't get it, and vice versa. So it's a little bit of an unknown. It's a little bit unfair.
Dara, how did the psoriasis manifest itself with you?
Well, I started to notice red patches on my elbows back in the early 90s when I was training for the 92 Olympic team. And I didn't really know what it was. I thought maybe there was a chemical in the pool that was irritating my skin. But after a couple months, it didn't go away. And I finally went to my dermatologist, and that's when I was first diagnosed with psoriasis. And for me personally, being that my business suit is my swimsuit, it was a little embarrassing. And I didn't know if people were going to think if they touched me, they were going to get it, or if they were in the same pool as me, were they going to get this disease? So that was really tough for me at first, but I realized really quickly that I shouldn't care what people think, because I want to go for another Olympic team, and I'm not going to do that if I'm not my swimsuit in the pool swimming. So I'm very, very psyched to be teamed with Otezla and Celgene for the Show More of You campaign to really educate people about what psoriasis is and psoriatic disease is, and also for them to teach people to be comfortable in their own skin.
Now tell me more about the Show More of You campaign.
Oh, it's a wonderful campaign. We did a awesome photo shoot with famed photographer Martin Scholler. It was really a lot of fun, lots of loud music playing, lots of fun pictures. But I was also there with 4 other people suffering from psoriatic disease, and we were able to sit down and talk about our disease together and just give each other support. And it was just a very comforting day that we all were involved with. If you go to showmoreofyou.com on the website, you can see our photos on there, but also very inspiring stories that people have told who have suffered from psoriatic disease, and also they've uploaded their photos, and we encourage people to do that. We encourage people who don't know a lot about the psoriatic disease to go on there and learn more about it.
Now, do you have a message of hope for people who have this?
I think the biggest message is it's not like it's something that just goes away. I mean, mine is flared up when I get really stressed out. So I know for me personally, to go work out or do something that's going to relieve stress helps me not get it, or makes it go away a little bit more. But everyone's condition is different. So my advice is just don't worry about what other people think. Be comfortable in your own skin.
And along those lines, Dara, what do you like to do for fun when you're not working or running around 11-year-old?
Working out. That's like my life. I just love health and fitness. And, you know, in today's day and age, there's different situations that can get you very stressed out. And again, stress is what makes my psoriasis flares up. So I love to go box. I love to go do bar method. I do my little swimming, and I'm a happy camper once I get a little exercise in.
Now, where can people go to find more information about this campaign?
You want to go to showmoreofyou.com, and again, we encourage people to go to the website, learn more about it if you don't know what psoriatic disease is, and also if you are suffering from it, upload your pictures and inspirational stories, because we really love to see them and hear them.
And Dara, how do you like people to connect with you? I'm sure you have so many fans.
I have my own website, daratorres.com. Thanks for the plug, by the way. And I'm also on Twitter and Instagram.
Great. Well, thank you guys both very much. Good luck to you with your campaign.
Thanks for the great questions.
Thank you.
Bye-bye.